Hello, my name is Crystal Barajas, and I will be presenting Dorothea Orem's Self-Care Deficient Nursing Theory. Who is Dorothea Orem? She was born in Baltimore, Maryland on June 15, 1914. At the age of 92, Orem died on June 22, 2007 in Savannah, Georgia. She received her nursing diploma from the Providence Hospital School of Nursing in Washington, D.C. in 1934. She also attended the Catholic University of America to earn a B.S. in nursing education in 1939. She also received her an M.S. in nursing education in 1945. Her careers: 1934 through 1936 and 1942, she was working at the Providence Hospital in Washington, D.C. 1936 to 1937, she worked at St. John's Hospital, located in Lowell, Massachusetts. 1939 to 1941, she taught biological science and nursing in Providence Hospital School of Nursing. And then also, after receiving advanced degrees, Orem focused primarily on teaching and research and administration. So if you could see below, starting at 1939 to 1941, that's when she started focusing more on teaching, research, and administration. And then 1964 to 1970, she became associate professor. And then 1965 to 1966, she became a dean of the School of Nursing. Publications and works. In 1959, guidelines for developing curricula for the education of practice nurses was developed by her. In 1971, she first published her formal articulation of ideas in nursing and concepts of practice. Subsequent works of her theory were published in 1980, 1985, 1991, 1995, and 2001. Orem's self-care model is a significant contribution to nursing education and the profession of nursing. It promotes recovery and healing, and it also focuses on patients. Orem's nursing theories are composed of three theories: theory of self-care, theory of self-care deficit, theory of nursing systems. The theory of self-care describes how people can be helped through proper nursing practices. This theory explains 5 methods of helping when a person is not capable of caring for himself. The methods are as follows: acting or doing for another; 2, guiding and directing others; 3, providing either psychological or emotional support; 4, maintaining a helpful environment to develop personally; and 5, educating others. The theory involves mainly 4 core components. They are: number 1, the self-care. It is the ability of the person to care for himself. Self-care deficient. It refers to when a person is incapable of caring for himself and he needs some external assistance. 3, self-care demand. It refers to the assistance or request by the client from the nursing agency to meet his self-care. 4, nursing agency. These are the professionally trained and skilled nurses act and meet the therapeutic self-care demands. The second part of the theory, the self-care deficient theory, developed because of Dorothea Orem working towards her goal of improving the quality of nursing in general hospitals in her state. So the theory of the self-care deficient involves coordination of nursing care in the hospital, coordinating with other staff members such as dietitians, psychotherapists, etc., for the effective nursing care delivery. Number 3, providing the clients all assistance until his full recovery. 4, discharging and follow-up of the patients. Self-care is an essential aspect nursing practice and can significantly impact a person's overall health and well-being. The 5 benefits of self-care are: 1. Improve physical health. Regular self-care practices such as exercise, healthy eating, and adequate sleep can help to maintain physical health and prevent illness. 2. Enhance mental health. Engaging in self-care activities such as mindfulness and stress management techniques can help to improve mental health and reduce symptoms of anxiety and depression. Number 3, increase energy levels. Engaging in self-care activities can boost energy levels and help to reduce feelings of fatigue and burnout. Improved relationships. Practicing self-care can enhance relationships by reducing stress, improving communication, and fostering a sense of connection. And number 5, increase overall happiness and satisfaction. Self-care can increase feelings of happiness, joy, and satisfaction with life. The theory of the nursing systems describes how patient self-care needs will be met by the nurse, the patient, or by both. The nursing system is the product of a series of relations between the persons, legitimate nurse and legitimate client. This system is activated when the client's therapeutic self-care demand exceeds the available self-care agency, leading to the nursing. Examples are care of a newborn, care of a client recovering from surgery in a post-anesthetic care unit. Nurse can assist the post-operative client in ambulating. Nurse can bring a meal tray for the client who will feed himself. Supportive educative system. The person can perform or can and should learn to perform required measures of externally or internally orientated therapeutic self-care, but cannot do so without assistance. Example: nurse guides a mother on how to breastfeed her baby, counseling a psychiatric client on a more adaptive coping strategies. Examples of self-care theory include a nurse teaching a new mother how to breastfeed a newborn, counseling a psychiatric patient, instilling a patient better coping mechanisms after an emotional trauma, teaching a patient how to meditate. Discussion questions. How is Orem theory useful in current nursing practice? Orem's self-care deficient nursing theory could be classified as what type of theory and why? What was the critical question that was the standing point for Orem's self-care deficient theory? Conclusion. 1971 first published her formal articulation of ideas in nursing, concept of practice, composed of 3 theories: theory of self-care, theory of self-care deficient, and theory of the nursing system. Dorothea Orem's theory is the act of assisting others in the provision and management of self-care to maintain or improve human functioning at home level of effectiveness. This law focuses on assisting others to increase the ability to perform self-care and maintain personal hygiene. So by these physicians can teach self-care tips and patients can do their work themselves. So nurses no need to give care for patient for a longer period, and patients are not needed to stay longer periods in the hospital. So Dorothy Orem's theory definitely advanced nursing for the better. And then my reference. Thank you for listening to my presentation.